Hello, this is Dr. Karkare, and I want to discuss a very concerning, serious, and a very important topic today. It's about whether Bach Flower Remedies or Homeopathy can treat homosexuality. Before we start this topic, I think I should make a disclaimer here that me or my clinical assistants or anybody at Swarup Clinic, we recognize LGBTQ individuals as natural. We don't consider that as disease, and therefore there is no treatment. This video is primarily to clear all kinds of misconceptions and provide emotional support to everyone, the individuals as well as their parents, to build strength and understanding. So this has to be very clear in the beginning. Now, why this question today? The reason being, uh, actually, I wanted to do a YouTube live, but then I thought that instead of YouTube live, because this is a very detailed topic and we need to discuss it in detail. Almost once a month or more than one or two call, I get one or two calls in a month from anxious, mentally disturbed parents who are either anxious or they are angry, they are frustrated, they are shocked, they are sad, depressed, they don't know what to do now, and they, because their kid expresses their homosexual orientation to them, the kid says that he or she is attracted towards the same sex, and the parents, they just uh, get disturbed like anything. In that frustration, in that desperation, they call everybody for the help, and then such calls, they come to me as a Bach Flower therapist and homeopathy physician, and they ask me this, that can Bach Flower therapy or homeopathy make my homosexual child normal? I'm saying in quotes normal because they feel that this is not normal and this has to be treated now, and the child has to be made straight or like a normal child, the usual child, the child that they had dreamt about. So they are desperate. So basically, my job is to talk to them, to comfort them about how the things are going now and what we can offer to them. So basically, as I said in a disclaimer, homosexuality, or if somebody has a homosexual sexual orientation, that's natural. Although it's not the usual one or the usual pattern, but still it's natural. And because it's natural, you cannot treat it. To give you an example, it's just like if somebody has a curly hair, and if somebody, that person comes to me and saying that treat me so that my hair becomes straight, I can't treat him because genetically that person's hair are curly. Same goes with skin tone, same goes with height, same goes with handedness. If somebody is left-handed and their parents want that child to be right-handed, we can't do that. We can't force the child to be right-handed just because it's not commonly accepted. Now, what is commonly accepted by society does not mean that it's normal. Many normal, regular, natural things are not commonly accepted by society. So we should be concerned about what is normal and natural rather than what the society accepts or does not accept. Eye color, moles, uh, thermals. Thermals is somebody. There are people who want fan and AC even in winters. Uh, there are people who can go to Himalayas with just one thin T-shirt on, and there are people who can who need woolen garments and sweaters even in summers. So this is typical thermal orientation of a person. We cannot change that. If somebody likes sweets, if somebody does not like salty things or spicy things, you cannot change that because that's natural, that's normal for that individual. There are few people who sweat a lot, and there are few people who do not sweat at all. Even though they go to gym, even though they run a marathon, they don't sweat much. Now you cannot change that because that's natural for that particular person. It's the same way homosexuality can be natural for that particular individual. So you cannot treat it by any way. Not by Bach Flower Therapy, not with homeopathy, not with allopathy, not with anything per se. In fact, there are many clinics who can claim that they can treat homosexuality, then they charge you a bomb, then they either they treat or they pretend that they are treating with medicines, and then they will fool you, they will rob you of your money. And the problem is you cannot go and you cannot complain about it because then you will have to openly accept that there is a homosexual person in your house, and the shame and the guilt and the social stigma which is attached with homosexuality makes it difficult to report these people in public, as well as makes it easier for these people to fool parents and the kids. Now, some legal and technical background. Indian Psychiatric Society in 2018 declared that homosexuality is not a disease and it does not require treatment. Homeopathy and bachelor therapy believes the same. In 1973, much before even I was born, American Psychiatric Association had removed homosexuality from DSM criteria. WHO also removed homosexuality from ICD in 1992. So basically, internationally also homosexuality was not considered as disease for a very long time now. In India, it was criminalized till 2018, but on September 6th, 2018, Supreme Court of India decriminalized consensual same-sex relationships. Section 377 was abolished, and that was the big day for homosexual individuals. Still there are certain things which are not legalized in India are same-sex marriage, so that is still under the debate, and full legal recognition of homosexual individuals. So whether they can adopt a child, whether if they adopt a child, whether there can be inheritance and all those things. So there are certain things which are still under debate. They are still under Supreme Court's jurisdiction. So they have been discussing. They have been discussed and debated. So that those verdicts will come eventually. But just somebody being a homosexual person or individual is not a crime now, even in India, although the marriage is yet not legalized. If we see history of India, if we see Khajuraho temples, this is very typical common examples which are given. Khajuraho temples where there are sculptures about sex, sexual positions, and all those things. There have been sculptures about homosexual individuals as well. So most probably in ancient India, these things were commonly accepted, and these things. But that's not the topic. Whether it's right or wrong, or this is legal or illegal, that's not the topic today. Topic today is, can we treat, and how, what we can treat. So we will not be treating. We cannot treat homosexuality because, as I said, that is natural, and because something is natural, we cannot treat it. So because it's not a disease or disorder, it does not require any treatment. Sexuality is a natural spectrum and it's a part of person's identity. So what we can offer then as a bachelor therapist or as a homeopathic doctors? What we can afford? We can offer emotional support. We should offer emotional support to kids who uh, have opened out to their parents, who have been brave to tell the society and at least to their parents that they are homosexuals or they have homosexual orientation. They like uh, people of their own sex. So it's very brave step that a child can take. So we can actually help these kids to provide the emotional support that they need. We also need to take care of the parents because they are usually in the shock. They are almost devastated kind of state they are in. So with counseling and bachelor remedies, we can take care of these states. But again and again, I will say we won't be and we cannot treat homosexuality. We cannot treat homosexual orientation. So where actually bachelor therapy can help for the LGBTQ individuals, there is always difficulty in accepting and understanding one's sexual orientation and gender identity. Somebody who was born male, who feels now that he's a female. We are talking about LGBTQ spectrum now, not only L and G. So these kinds of difficulties accepting and the sexual orientation can be a problem. Somebody who is a gay or lesbian, it becomes difficult for them as well to accept that they are gay or they are lesbians, and because then they know exactly how society is going to react, how their parents are going to react, how everybody, right from their work, their society, the building in which they stay, their neighbors, their friends, everybody, how they are going to react in a very crisis or a panic situation. So the social stigma and discrimination that society does with these individuals, that's a major problem. That's a major concern for these people. So we can help them with counseling and help them to treat the anxieties and the fears that they have with bachelor remedies. There is also fear of rejection. If they come out that of their and they can voice out or they convey their feelings, then there is always a fear of rejection by their own parents, by their own people, by their own neighbors, their friends, and uh, everybody around them. So this fear of rejection makes them very difficult. See, in a difficult situation where they neither can accept nor they can stay hiding. So that becomes a very difficult situation for them. All these situations can create, especially the social pressure, can create anxiety, depression, and suicidal thoughts. These individuals in their young age, where all kinds of emotions are at a very supreme level, when they are suppressed, this causes a lot of mental disorders, mental difficulties, mental issues, and they can go into anxiety, depression. Their productivity at academic level can go down. There is a strong shame and guilt about one's identity at times because of the upbringing, because of the cultural upbringing that they are in. Even they are shocked to understand that their sexual identity, that is very common, that they are not comfortable with themselves. They feel why this happened to me. So even that needs to be taken care of. That needs to be addressed. That needs to be talked about with and talk to them. And all these things because there is no self acceptance, there is no comfort with oneself. They always face difficulties in forming and maintaining relationships with other people. The usual relationships as well. They feel shy. They feel like shutting themselves in the room and be with themselves. So all these things can be a major problem for these individuals. And I think we, as homeopathic doctors and bachelor therapists, we have a big role to play. I meet almost one or two clients every month, and the stories that I hear for them from the individuals as far as from their parents, it becomes very difficult to feel and understand their problems in the same intensity that they actually go through. Your empathy, your sympathy, your concern, and all those things, it falls short to the stories that they actually narrate. So the way they are rejected, the way they are discriminated, the way they are treated very badly by society, it becomes very difficult to uh, take care of their emotions. So uh, we should be uh, we should be actually very resourceful with the medications that we have, the counseling techniques that we can offer to these people because they really are in a dire need of all those things. As regards parents, there is always a shock and denial. They are always in shock. They feel no, 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 this cannot happen, and they want to treat that. They will come with you for treatment of homosexuality. So they feel just give him anything. We are ready to pay you any amount of money, but just make this person normal. And that we have to first address that particular demand of theirs. There is concern about child safety as well, because they know that if their child goes out in the society and declares his sexual orientation, they will be mentally and physically they can be harassed. There is a grief and loss, because, as I said, their so-called dream child concept has got shattered suddenly at the age of 15, 16, and 12 years of their child's life. So suddenly they don't they understand that they might not have now the normal child that they dreamt of, the child who will get married in the way they dreamt of. So that's a grief and loss that they lost a normal child. Then there are stigmas of social pressures and consequences of social consequences, how society will react to them, to their child, to everybody. Then there is a guilt and self blame as well. Ki, did we go wrong anywhere in the upbringing, in the parvarish, so that this person started behaving or thinking in this manner? And then all these things, they it leads to communication issues with the society. They also become shy. They also become locked. They also lock themselves up. And then communication issues with the child as well. The moment child declares that his sexual orientation is different than the usual people, different than the commonly seen people. These, though they can accept that this is natural, but still they feel shame and discomfort to discuss all these things with the kid as well. So the rest of the communication just goes on a stop. So they will say, okay, we understood, but now there won't be any discussion on this. So we need to counsel them, we need to talk to them, and we need to give them necessary homeopathic and flower remedy medicines to take care of all these things. So what homeopathy or flower remedies can achieve? They can achieve emotional balance from these fears, shame, guilt, anxieties, and depression. Once again, they it can't treat homosexuality because uh, it is natural. We can provide emotional healing. We can boost confidence. The self awareness can be enhanced with the medicines and talking to them, which can foster personal growth, and it can restore harmony and resilience in that family. If not treated well, if not treated in time, if not treated holistically in the sense taking care of the child as well as the parents and the family, a family can really go shattered, and it can become a very big problem for the family. So something which is natural can really cause a major problems in the family. The kids who haven't opened up with their parents, they feel more and more pressurized, more and more concerned. If they come to you, then that becomes another major hurdle, like major responsibility of you of telling them to at least talk to their parents about their orientation and what they are feeling. Now that becomes a very major task for the kids. So we can also help them, and we can also be a mediator between the child and the parents, so that uh, the communication from the kid to the parent about the sexual orientation can be smooth, can be less disturbing, can be we can be a buffer between the parents and the child. So all these responsibilities, they lie on our shoulders now, and we all can actually help these people to reach a harmony, a better relationship, a better family life, uh, by accepting the natural thing, uh, which is the right thing to do. Just accepting the natural orientation, the natural overall situation. So if you have any queries, if you want any help, please feel free to reach us for the therapy, as well as we can have guided meditation, rational self-suggestion tracks, which can help you to accept yourself, accept the situation, and sail through the crisis, so-called crisis, in a better and in a much healthier way. So, if you need any help, please free to reach us, and we will be ready to help you. Thank you.